Go.
नाजरीन अस्सलामुअलैकुम रहमतुल्लाहि व बरकातहू। डॉक्टर देवी प्रसाद शेट्टी एक बेहद मशहूर मकबूल मारूफ कार्डियोलॉजिस्ट हैं जो शहर बेंगलुरु में तमाम डॉक्टर्स में ये सफ़े अव्वल पर आते हैं और न सिर्फ बेंगलुरु बल्कि इंडिया के बेहतरीन बेस्ट कार्डियो हैं। इन्होंने अपनी MBBS की डिग्री मंगलूर के कस्तूरबा मेडिकल कॉलेज में किया। MS जनरल सर्जरी वो भी कस्तूरबा मेडिकल कॉलेज मंगलूर से किया है। डॉक्टर देवी प्रसाद शेट्टी नारायण हृदयालय के फाउंडर हैं और नारायण हृदयालय हॉस्पिटल के चेयरमैन भी हैं। तकरीबन इस मेडिकल फील्ड में, मेडिकल के मैदान में 20 पर 8 साल तजुर्बा रखते हैं। इस पैंडेमिक सिचुएशन में जो इंडिया में कोरोना का कहर फैला हुआ है, ऐसे मौके पर उन्होंने सरकार के सामने कुछ मशवरे दिए हैं, कुछ सजेशन रखे हैं। इसको आप इस वीडियो के ज़रिए देख सकते हैं और सुन भी सकते हैं।
With all of you, hopefully with your permission, I would like to change the topic of today's discussion. I prepared very well for the topic Rajiv has allotted, but looking at the way the situation in India, the pandemic situation in India is going on, I thought I should express my views to all of you exactly what I presume is going to be the scenario and what needs to be done. First of all, we are born in a very privileged country. We have overcome several unsurmountable problems in a very short period of time. We started COVID, our battle against COVID, with no PPEs and hardly 30,000 ventilators. In just 8 weeks, we were manufacturing surplus PPEs and ventilators, and we were in a position to export them in just 4 weeks. These are unthinkable by any standards. Now, the entire headline discussion on COVID is about oxygen. No one anticipated that it is going to happen in such a remarkably short period of time. It is happening in India mainly because we are a young nation with large number of youngsters interacting, working, and they get infected because, of course, due to the nature of the virus. I'm sure with the industries and the government intervention, in the next few weeks, we will be able to sort out the problem of oxygen, because we have a lot of steel factories which is run by very benevolent people, very industrious as well as benevolent people who will do everything possible to ensure that every person in the country who needs oxygen will get the oxygen. I'm concerned, I'm sad, I'm apprehensive, but I'm not worried because I know that the industries of this country will wake up to address this reality. But I'm having sleepless night for the next headline. From PPE and ventilator, we shifted to oxygen. And the next headline in the next few weeks, once the oxygen problem is solved, is going to be patients are dying in ICU because there are no nurses and doctors to take care of the patients. And this is going to happen. I have no doubt about it. Now, I'll explain to you why this is going to happen. We are testing about 3.5 lakh people as positive for COVID. For every patient who's tested positive, there are minimum of 5 to 10 people who are positive, but they are not tested. That means we are talking about at least over 15 to 20 lakh people who are getting infected every day in our large country. Statistically, 5% of the COVID positive patients need ICU bed, irrespective of their age. That means we need to have at least 80,000 ICU beds daily, new ICU beds daily. And many of you may not know, India has only 75,000 to 90,000 ICU beds, and all of them are packed already, and COVID has not reached the peak yet. And when a COVID patient enters the ICU, they spend minimum 10 days.